Hi, I'm Felicity, a registered nurse, cosmetic injector and clinic owner. Welcome to my channel, The Fit Injector. Today we are talking about a combination treatment of platelet-rich plasma to the neck area and a TCA peel to the full face on our gorgeous model. Now, the benefits of treating two areas with two different treatments is we get to target different things in the face and the neck, and then that client gets to have one lot of downtime, which is a really smart way to do things. Now, the reason we did the PRP to her neck was for skin rejuvenation and some very fine lines. And then we did the TCA peel to her full face for melasma. Now, I'm going to talk about this and we're actually going to watch the treatment at the same time. And I have done multiple videos on platelet-rich plasma, and I will link these in so you can learn more about what that is. But today I really wanted you to watch the treatment and how I perform that, and I want to dive more into TCA peels and melasma because that's something I haven't talked to you very much about. So melasma is a hormonal pigmentation and it can be really tricky to treat. And the TCA peel is trichlorotic acid, which is a fantastic treatment for melasma. Now, it is available in varying strengths and I use a 20% on my clients. And the benefit of this is you can layer it up depending on the skin's tolerance, and each time you can push the skin a little bit further to get an even better result. Now, I do need clients to prepare their skin prior to this treatment because it is considered a medium strength peel. So clients need to be using active ingredients on their skin for at least 2 weeks prior to the treatment. And for any client that books in for this treatment, obviously I guide you through that. Now, our gorgeous model, she has had pretty much every skin treatment out there and she's using fantastic active products. So her skin was prepped and ready to go. And I also knew that we could push her skin a little bit with this peel, and I knew she was going to get really good results with minimal risks of any damage to her skin. So let's have a look at the process. So we obviously cleanse the skin prior, and then I apply 3 layers of the TCA peel with the little cotton tips all over the full face across all those areas of melasma. And she does have some underlying sun damage as well. So it is really going to target both of those things. And we wait 3 minutes in between. Clients report like a tingly, sort of hot, almost a little bit of a burning sensation. If that sensation isn't settling down in that 3-minute break, then we're obviously not continuing with another layer, but her skin was going so well. So we did do 3 layers. This was her first treatment with the TCA peel. So when she comes back in about 4 to 6 weeks for her repeat one, we may push the skin and do 4 layers the next time. One of the things I love about this peel is it is self-neutralizing, so we don't need to wash it off. Once the peel has finished, we do then just follow with some moisturizer, of course, that has sunscreen in it, and then you don't need to touch the skin for the rest of the day. I actually recommend not to even cleanse your skin that evening, just leave it. Not to use any active ingredients for the next 7 to 10 days because you do need to plan for your skin to be dry, flaky, and shedding for about 7 to 10 days. Those darker areas of pigmentation and melasma will actually dry up and then flake off, and then you can expect fresh, healthy, glowing skin with less pigmentation about 2 weeks after your peel. So some of you may have heard me talk about the TCA and the Jessner Peel. So here obviously we're using the TCA peel, which I choose for clients who are more dry, a little bit more sensitive, sun damage and melasma. The alternative to this peel is the Jessner Peel, which combines lactic and salicylic acid, which is better for skins that are oily, breakout prone, the skin that kind of needs a reset, like you might be just starting to get over a large breakout and you just need to reset the skin. That is perfect for you. And you don't have to stress about which one to choose because I will do that for you when I assess your skin. So then the second treatment that I did in combination with the TCA peel was the PRP to her neck. So quick recap on PRP, it is platelet-rich plasma. It uses your own blood product. We take some blood, just like having a blood test. We spin it in a machine, which then separates the red blood cells from the plasma. Think about plasma like liquid gold. We then re-inject that into areas of concern for clients, and the benefits are that it stimulates your own collagen and elastin production. So it is your in the background hero anti-aging treatment. So the reason we treated her neck, like I mentioned at the start, was She's done so many treatments to her face. The neck has been a little bit neglected, even though she's young and beautiful and nothing to worry about. But she wants to make sure that as she ages, that her neck and face will be looking as best as they can. So this is a perfect treatment because she doesn't need any anti-wrinkles or dermal fillers in that area. She just needs that little bit of stimulation of collagen and elastin production, and she's noticing a few little fine lines, mainly from sleeping, and this will help to just plump those out as well. So what we did after we took her blood and we spun it in the machine in the centrifuge, I then used, and you can see here, the 5-prong stamp. Now this is my favorite way to do the neck. I find clients find it more comfortable in the neck region than the needle, and it also means I can do the treatment a little bit more quicker for you as well. Now remembering I always apply the topical numbing, which she had working while we did the TCA Peel to her face. And then I put a full mil of the plasma onto each side of the neck, as you can see, working down the whole sections. And then with the remaining mil, because I got 3 mils of the platelet-rich plasma, I then targeted those little fine lines, and I really got into those lines to make sure that I give her the best possible treatment. So once we finished, I popped her straight under the infrared LED, which is the best one to calm down the redness, the inflammation, and help to prevent any excess bruising. She got a nice 15-minute relax under there. And then we covered her in moisturizer and she was ready to go. I have since spoken to her. She said she's been having some mild flaking of the skin, but absolutely no concerns, and that she's feeling like her neck area is already looking a bit more plump, which is exactly what we want. And we will follow up again in about 4 to 6 weeks, and we will repeat both of those treatments. The plan is to do a course of 3. So doing 2 more, and then as maintenance, I'll probably do those treatments for her about once every 6 to 12 months. Thank you so much for watching. I hope you enjoyed watching this combination treatment as much as I did. And I think a lot of clients don't realize that we can do multiple things in one session. And I love doing that for you because it means you get to have one lot of downtime and you get to come in, you don't have to come in all these times. We can actually bunch everything together. So questions, drop them below. I love answering them. If you found this helpful, give it a thumbs up. Don't forget to subscribe for more. We've got plenty on the way.